السلام عليكم. For the first premolar, it's the first tooth in the arch for posterior teeth. It's placed behind the canine. Still within the arch, we have drawn on the wax rim and on the glass slab. The cusps that touch are the buccal cusp. The palatal cusp is a bit raised. Buccal cusp touching, the palatal is a bit raised. The central fossa here is in line, will create a second line of reference. Other than the outer line, we will have a second line of reference, which will be the central fossae of the teeth together. So we can notice here the canine rotation. The mesial is with the anterior teeth. The distal of the canine shifts to come in line with the posterior teeth. The buccal cusp is touching. The premolar is upright. Okay, and it's still with the occlusal plane with the anterior teeth. And we're going to fix it into location. So we make sure that all teeth are aligned correctly. If the neck, the teeth should be, canine and premolars should be upright. So if any tilt in the neck, the tooth, we just simply push it into place. The canine, we're using still the softness of the wax. We are pushing the neck of the premolar to make it not tilted but upright. The canine has a slight tilt to the distal, but the premolar should be upright. And now it's on the glass slab and still in the arch. We continue to the second premolar. Fixing the teeth into location. A point about fixing teeth. We have to make sure that each tooth has enough wax around it, fixing it into place. Because many times the students, while setting the teeth, have a problem that the teeth begin moving. So we need a reference for the setting. So we want to make sure that we have enough wax around the tooth to embed it and support it, not moving while adding other teeth in. Second premolar is added. We push it into the molten wax. We melt the wax beneath it, and we push it into the molten wax. Okay, and we make sure that it is in line with the other teeth. The tooth is upright. Both cusps are touching in this time. So both cusps are touching the glass slab at this time, and we fix it into place. The tooth is upright, as you see. And the central fossa of the second premolar is going with the central fossa of the first premolar. Premolar added, it's in the arch. The central fossa is in line with the central fossa. Now we remove another box of wax for the molar. The molar is added. It's the beginning of a third line of the arch, which is the most posterior teeth. The upper six has two parts, two halves. As we said, the canine was a cornerstone, and it had a mesial going with the incisors and the distal half going with the premolars. The molar has the same thing. It has two halves. This half is going with the molars, the premolars, sorry, and the distal half will go in another line a bit to the inside, going with the 7. So we have two planes. So the 6 has two planes. So the mesial part of it is going with the premolars and the canine. The distal part will go slightly to the inside, and it will be going with the second molar. We check that the 6 is touching the glass slab only in the mesio-palatal cusp. It's the only cusp touching the glass slab. Why? Because also the 6 is shifting upwards, creating what we call curve of speed. So once we put it on the glass slab, we can see that there is a buccal tilt. These two buccal cusps are not touching. The palatal cusp distally is not touching. The only cusp touching is the mesio-palatal cusp. So what we will have the beginning of the posterior teeth also going up as well. And this is creating what we call curve of speed. The curve of speed. So 6 begins, this is where a shift in the occlusal plane occurs to create what we call curve of speed. And only the mesio-palatal cusp is touching the glass slab. Mesio-palatal. For the second premolar, both cusps, the first premolar only the palatal, the incisor is touching. Lateral is not touching the occlusal plane. Now, when you open the window for 7, tooth number 7, make sure you leave some wax distally. So, wax distally will keep space and make you sure that you're still on the occlusal table. We want this posterior reference to stay up to the point where you're going to do a wax up. So when you open the last window for tooth number 7, make sure that tooth number 7, you're leaving some wax distal to it to give you a guidance where was the occlusal table before adding tooth number 7. Because remember, tooth number 7 will not be touching the occlusal plane. It will be higher to create what we call curve of speed. So we open a window. When we open the window, make sure that we are not making the base plate appear. We're still leaving wax beneath it. Now, if you have used the accurate measurements for the wax rims and the height of the wax rim, you will not need to trim the teeth. You will have space to add the teeth without touching the base plate. But in some cases where some of you did not follow the measurements, we will have the base plate appearing and still the tooth, we could not place it in place. This is where we do something called the trimming of the teeth. We will be talking about the trimming of the teeth later. So take a close look at tooth number 7. Tooth number 7 will have no cusps touching. The central fossa of the 7 is going with the 6. And we are putting it into the wax in a way where its distal end is higher than the mesial end. The mesial end here is with the distal of the 6. The distal of the 6 is the mesial of the 6 is touching the palatal part. So this is where, if I'm putting it on the glass slab here, notice what we call curve of speed. The teeth are raising in a manner, okay? So all of the teeth touching, but then at the tooth number 6 we begin going upwards, and this is what's called curve of speed. So we have the teeth going upwards, and then we fix tooth number 7 into place. It's in line with tooth number 6, the central fossa. This is the first line, this is the second line. The molars have a buccal line different than the central fossa line. We will emphasize the lines and the references for our setting once we finish the setting and tell you about them. So we fix the tooth into place. Make sure that the wax supports the teeth in a good manner. We are heating the instrument, making sure that the hot knife is touching both the tooth and the wax, because we want the wax fixed to it. We are putting wax in the interdental papilla area between teeth. And then we begin cleaning the wax from around the teeth to finalize the setting. So now we are checking the teeth on the arch we have drawn in the beginning, making sure that all teeth are still in the line of the arch provided for you. So you'll have this arch provided. From the inside, we can see which cusps are touching and which are not. So if I'm looking from the inside, I could see that tooth number 7 is not touching the glass line. Now, once we have fixed all teeth into the location, we made sure that the wax is surrounding the teeth very well. Okay. Using the tip, we are smoothing the wax on the base plate area, in this area. So any remnants of wax, we just smooth it, as we have done with the wax rim. We are making sure that the wax is going in between the teeth in the interdental papilla area. So the hot instrument is going with molten wax in between the teeth. And then we could use the lacron carver to expose the buccal surface of the teeth from wax. There is another step where we're going to do a wax up, that's later, but just when you're doing submission of the setting, you have to have the buccal surface clean. We need to wait for the wax to totally solidify. And then we begin exposing the buccal surfaces of teeth. We're exposing the labial surfaces of teeth up to the neck, which is the clinical crown area. So no wax should be on the buccal surface of the teeth or the occlusal table of the teeth when you submit your work. The junction of the wax with the base plate should be smooth. We are using now the lacron carver inverted upwards. You can see with the tip inverted upwards, just to try to clear the final margin of the what will resembles the gingiva in the teeth. We make sure that the pupilla are still filled with wax. We're just exposing the labial surfaces of teeth and the buccal surfaces of teeth. Make sure while setting that no wax goes on the fitting surface of the base plate or the border of the base plate. So any wax around these areas, any wax on the fitting it should not at any time drip any wax on the fitting surface, because this will not fit on the cast when we put it back. So we need to make sure that no wax has gone into the palatal surface, fitting surface of the teeth. And once you finish this step, after cleaning the teeth, go back and check on the glass slab. It's still fitting and all teeth are touching the glass slab as the rules of sitting we have talked about, and which you have as a plate on your paper. So we're going to put it just quickly and check which teeth cusps are touching and which are not. Okay? Because sometimes while cleaning, the teeth move if you don't allow the wax to cool off enough. And all excess wax that has gone into the palatal, you just remove it. We have wiped the teeth with a tissue. All excess wax is removed. A smooth junction should be between the wax and the base plate in this area. So this is the setting of the teeth. This last part, we have just used the flame to gently heat the surface of the wax, not the teeth, and make sure that no wax is still on the teeth. And this is our setting already. And we make sure finally that the cusps that are touching are still all there. Thank you.